Substance use disorders are complex conditions that affect millions of individuals worldwide. This presentation will explore the definition, causes, effects, diagnosis, and treatment options available for those that are facing substance use disorders. Almost every day in hospital social work, we are faced with someone who has some type of substance use disorder, whether it's polysubstance abuse, alcohol abuse, or one single substance. We face this every single day. One of our greatest challenges is probably what resources do we refer them to, and do they want help? Genetic predisposition plays a significant role in substance use disorders. Individuals with a family history of addiction may have a higher risk of developing similar issues due to inherited traits. We also think of the old nature versus nurture argument. Is it genetic if you've witnessed your parents or caretakers abusing substances most of your life, and then you turn to that behavior as an unhealthy coping skill? Comorbidity with mental health conditions such as depression, anxiety, and trauma are also closely linked to substance use disorders. These factors can lead individuals to substances using them as a coping mechanism. Factors such as peer pressure, socioeconomic status, and exposure to substance use in the community or in the home can heavily influence an individual's likelihood of developing a substance use disorder. The DSM-5-TR outlines specific criteria for diagnosing substance use disorders. These include patterns of use, cravings, and the impact on daily life and responsibilities. Clinicians choose from various assessment tools, including questionnaires and interviews, to evaluate the severity of the substance use disorder. They also evaluate the readiness to change. These tools help tailor treatment and approaches that are meeting the individual's needs. Diagnosing substance use disorders can be very challenging due to stigma, co-occurring disorders, and variability in symptoms. Awareness and training for healthcare professionals are vital. Another conflicting factor is how honest is your patient being, right? Oh, I only drink once in a while. Doesn't tell you that they drink, a bottle of wine every night, right? So often, if a patient isn't going to be honest with us, it's very hard to get to a correct diagnosis as well. Behavioral therapy, such as cognitive behavior therapy and motivational interviewing, focus on changing substance use behaviors and fostering coping skills. DBT is a newer modality for substance use disorders, but is proving very useful as well. I've seen patients put down a substance and never touch it again. I currently have a client on my private caseload that hasn't used crack cocaine in 4 weeks, which is remarkable because he's not using medications and unfortunately is not ready for treatment yet. But it gives me hope. Other people need medications such as methadone for opioid dependence. These things can play an essential role in treatment by managing the withdrawal symptoms and reducing cravings. Support systems are so imperative. Family involvement, aftercare programs, outpatient or inpatient treatment, peer support groups, any type of support that a patient or a client can get while they're going through substance use treatment, withdrawals, or readiness for change can support them and help them avoid relapse. Effective preventive strategies can include early intervention, community education, and promoting healthy lifestyles. We all have healthy and unhealthy coping skills. It's imperative that we help our patients and our clients realize their healthy coping skills, reduce their unhealthy coping skills, and maximize their potential. There's a lot of room for macro level social work here as well. Public awareness campaigns can help reduce stigma, promote understanding of substance use disorders, and these initiatives can encourage individuals to seek help and support, and can also encourage our legislators to make the needed changes to support mental health treatment, normalize mental health, and make it available on every insurance plan, or if you don't have insurance. Knowledge is elemental. Implementing educational programs in schools and communities can help raise awareness about the risk of substance use and abuse and educate individuals on coping strategies and healthy choices. Substance use disorders are complex conditions that require a multifaceted approach to treatment and prevention. By understanding the causes, effects, and available resources, we can better support individuals on their path to recovery. And we always remember every client is unique. Every client has their own set of parameters and factors that are affecting their daily life that led them to substance use and that can lead them away from it. Thank you very much.